Well, I was working at a hospital at the time in the midst of the pandemic, and I was the infection prevention nurse, and I was just wanting to go back to working in public health. I felt that during a pandemic, it was a great time, and the job that I had was very, not just stressful, but kind of out of control because they really didn't understand that they needed somebody full-time to do it, and I was doing basically 2 jobs, and at one point actually doing 3 jobs. So it was difficult to continue to do that. And my husband, I've always liked the Central Coast. We lived in San Luis Obispo County for a long time, so it just made sense to move to Monterey. And I'd done a lot of public health under health department, and I was looking for something different, something that I hadn't done before, that I could kind of wind up the last few years of my career before I retired. And so I saw this job in Monterey County for a public health nurse in APS, and I thought, well, that's interesting. They use public health nurses in their APS. And I thought, well, I'm going to apply for it. And so I did, and here I am. I have always worked in the service industry in the sense that I've always worked almost my entire life for either the state, the county, the city, as someone who provides a service for the community. And my work ethic is that the community, my neighbors, everybody in the community pays my salary. So I have an obligation to be ethical, to show up to work on time, to do my work, and to do it well to the best of my ability. Now, let's not discount the fact that, hey, the benefits are great and my pay is good. But all of us know that if you work for the county, the state, unless you're in the high echelons of the CEO or that kind of stuff, we don't go into this for the money. Yes, the pay is pretty darn good here in Monterey County, but it's not for the money. And if you just want the money, then working in the service-oriented public sector is not where you want to be, because you're going to work hard and you owe it to the community, since they're paying your salary, to do your best and to work hard for them. So I encourage you to, explore it and to, like I said, reach out to other public health nurses in Monterey County and see how they like their job and what they do. Reach out to the public health nurses in APS and see Adult Protective Services and see what they do and how they like it. And know that they're moving towards more of a long-term case management for the public health nurses, and so that might be more appealing to some of you who prefer that where you have more time to connect with resources. But it's beautiful here, unless you really like hot weather, and this is not the place to be because it never gets that hot. It's cool all year round, so don't come here if you want hot weather. Because the Salinas Valley is not hot. I mean, maybe it gets to 85 down in the King City area, but not for very long. And so keep that in mind if you're moving from out of the county. If you already live in the county, you know what the weather's like. It's a great place to work. There's a lot of supportive staff. We support each other because it's definitely not just about the money here. And I find that in most of the jobs in the county, people don't do it just for the money.